Motion on the Tasmanian health system.
Thank you, and I give the call to the member for Clark.
Deputy Speaker, I move the motion relating to the Tasmanian health system in the terms in which it appears on the notice paper. Deputy Speaker, regrettably there is an urgent need for federal intervention in Tasmania's ailing public health system, and in particular there's an urgent need for the federal government to direct the Federal Productivity Commission to do a review of Tasmania's public health system and to help Tasmania by laying out a blueprint for reform. Deputy Speaker, that's not to say that a string of Tasmanian governments haven't conducted inquiries, ordered inquiries, spent money, put band-aids on, done different things to try and fix Tasmania's public health system. But regrettably, none of it has worked. Indeed, it has now become commonplace for emergency department doctors and nurses at the Royal Hobart Hospital to warn how bed block and the ramping of ambulances is disrupting quality health care and even resulting in unnecessary deaths. Deputy Speaker, to illustrate this point, last fiscal year in Tasmania, over 1,800 patients waited over 24 hours just to be seen in the emergency department. No wonder that the AMA is also cautioning about this situation. And the AMA notes that waiting lists for elective surgery at the Royal Hobart Hospital are now the worst in over 20 years. Deputy Speaker, we don't need to go to organisations like that to get a sense of things. We can just look at the state government's own figures. And indeed, by the state government's latest figures, there are 11,342 patients on the elective surgery waiting list. That's out of a total population of only 500,000 people for the whole state, Deputy Speaker. 11,342 Tasmanians on the elective surgery waiting list. And remarkably, those who are on the Category 1 waiting list are waiting on average 130 days for their surgery, when the clinically recommended waiting time is to be no more than 30 days. Deputy Speaker, they're numbers, but remember, behind all these numbers are human stories. For example, the elderly man, a constituent of mine, who's been waiting for hip surgery for ages, and he's in so much pain and he's so disabled that he needs to call on his neighbours to change his socks. There's nothing elective about that, Deputy Speaker. It's a human tragedy. Well, just last week, the mother of 4 who contacted my office when a day before she was scheduled for urgent colon surgery, the surgery was cancelled. Deputy Speaker, this woman can't work. She's in extreme pain. She suffers embarrassing bowel movements, and her surgery was cancelled last week, and the state government thinks that's okay. Deputy Speaker, mental health is especially problematic. And I could give you some shocking examples or demonstrations of just how bad things are. Like the man who cut off his finger to ensure he would be admitted to the Royal Hobart Hospital to get the mental health care he was calling out for. Or the example of a man found dead in the bushes outside the Royal Hobart Hospital not that long ago, who had twice been turned away from the hospital when he was desperately calling out for mental health treatment. Deputy Speaker, the government says it's on the job and all's well. And to his credit, last week the Premier did announce $45 million to boost elective surgery. But frankly, it's a band-aid when the public health system has such systemic, structural and funding problems. Deputy Speaker, that's why today I'm calling again, and I've done it before unsuccessfully, but I'm calling again for federal intervention, not to disrupt the Tasmanian public health system, but to help the Tasmanian public health system. To get an independent body like the Productivity Commission to go in with all its know-how, and it's not unprecedented for federal intervention in Tasmania. For example, Prime Minister Gillard agreed to my request for a $325 million funding boost. And we've had the episode of hospitals being taken over and handed back and all sorts of things. So we need the Productivity Commission to step in. And Deputy Speaker, I'll take this opportunity again to call for the closure of one of Tasmania's 3 northern hospitals. We have 3 hospitals in the north, 1 hospital in the south. 3 hospitals for half the population, 1 hospital for half the population. We have too many hospitals and they are underfunded. I call again on the Tasmanian government to shut one of the 3 northern hospitals so that will leave 3 well-funded hospitals instead of 4 underfunded hospitals. Deputy Speaker, we've got to stop the band-aids. The Tasmanian government has got to look to the feds for help. The community has got to understand we've got to stop putting band-aids on the public health system. We've got to fix it, because until we fix it, people will continue to suffer unnecessarily. People will continue to die unnecessarily. Thank you, Deputy Speaker.